सो ये गाइस आज हम टेबल वर्क कर रहे हैं वाइवा के लिए। तो पहला सवाल होता है कि मेंशन वन इंडिकेशन डोज एंड रूट ऑफ एडमिनिस्ट्रेशन ऑफ एड्रेनलिन। तो ये एड्रेनलिन में आता है एनाफाइटिक शॉक एंड एपीसेक्सिस, और इसमें क्या होता है 0.5 ml देते हैं हम इंट्रामस्कुलर। ओके, नेक्स्ट आता है कि डिफाइन एस्ट्रिंजेंट। तो सब्सटेंस प्रेसिपिटेट सुपरफिशियल लेयर टू फॉर्म ए प्रोटेक्टिव कवरिंग के लिए, और ये मैकेनिकल स्ट्रेंथ प्रोवाइड करती है। फिर नेक्स्ट है कि राइट एनी टू मेरिट्स ऑफ सर्विंग रूट एडमिशन टू एग्जाम्पल। सो ये कि क्विक एक्शन होता है बिकॉज रैपिड ऑब्जर्वेशन होता है बक्कल म्यूकोसा से, और फिर टर्मिनेट कर सकते हैं हम एक्शन बाय स्पिटिंग आउट द टेबलेट, एग्जाम्पल नाइट्रोग्लिसरीन आइसोसोर्बाइड डाइनाइट्रेट। और ओके, एंड नेक्स्ट इज two examples of high ceiling diuretic and two example of thiazide abrasives. So high ceiling example are furosemide and torsemide, and thiazide example are hydrochlorothiazide and indopamide. Now I write two example of local substituent to use this. So two example are 0.1% adrenaline and thrombin, and uses bleeding time bleeding gums, epistaxis, bleeding tooth socket. Mention any four uses skeletal muscle reaction. So add. So they are used in ECT, tetanus, status hepatitis, orthopedic manipulators, and adjuvant to general anesthesia. Okay, next define plasma half-life. So plasma half-life is defined is a drug of a drug is the time taken for its plasma concentration to reduce to half of its original value. Okay, example digitoxin 7 days and ismolol 10 minutes. Okay, now next is second gen antihistamines example in using. So example is cetirizine, levocetirizine, and fexofuril. Okay, they are used in allergenic rhinitis, urticarial insect bite, and atrophic clamaditis. Okay, allergic rhinitis, urticarial insect bite, and atrophic clamaditis. Okay, next two drugs used to avoid an acute attack of angina: glyceryl trinitrate, and isosorbate dinitrate. Okay, next two interaction of warfarin. So rifampicin, and carbamazepine induce the metabolism of warfarin. Higher dose may be needed, and phenytoin displaces the warfarin from plasma binding and enhance anticoagulation. Okay, next hypertension on pregnancy we use labetalol, nifedipine, and on hypertensive emergency we use labetalol, ismolol, nincardine, and furosemide. Okay, next is inhalation. Inhalation, general anesthetic, and two local anesthetic. So inhalation general anesthetic include pentose sodium and sevoflurane, and local lignocaine and bupivacaine. Next is two drugs in pre-anesthetic medication proposed which they are used. Okay, this includes BPM, benzodiazepine, diazepam, and lorazepam, which are sedative and anti-anxiety. Next is pantoprazole, which decreases acidity and volume of gastric juice. Next is metoclopradine, which is an antiemetic and reduce reflex and its aspiration. Okay. Next is name antidote for warfarin overdose. So vitamin K, and use of warfarin is a deep vein thrombosis. Mention any two contraindication in parentheses. Is tetracycline, and the next is ACE inhibitor. Next is you have to example of cyproflexin, urinary tract infection, and typhoid. Mention was as a first line anti-TB drug. This includes isoniazid and rifampicin. Okay, isoniazid is advocates hepatitis, and so is rifampicin, which also produces flu-like symptoms and rash. Name any two drugs used for oropharyngeal contraction. which are CF, clotrimazole and fluconazole. Clotrimazole, fluconazole. Okay. Um, Name any true drugs belong to two different classes and then it is bronchial asthma. When bronchodilators and leukotriene antagonists. Bronchodilators, leukotriene. So this includes salbutamol and terbutaline, salbutamol, terbutaline, and leukotriene antagonists include monoleucas and zephyroleucas, monoleucas and zephyroleucas. Okay, next is uses of odensanol, which includes chemotherapy induced vomiting and prevention and treatment of post-operative nausea vomiting. Okay, and next is inhalation glucocorticoids. So this includes BF, budesonide and fluticasone. Budesonide and fluticasone. Budesonide. Adverse effects is crushing habitats, frack skin and purple stray on thighs and lower abdomen, hyperglycemia and growth retardation. Next mention any two selective COX-2 inhibitors. So this includes celecoxib, celecoxib and etoricoxib, and uses are rheumatoid arthritis, ankylosis, okay, and spondylitis. Mention into antibiotic effects against pseudomonas. Okay, antibiotic against pseudomonas are carmethylcin and piperacillin. Okay, penicillin and carmethylcin. Okay, and cefoperazone. Okay, mention it which can should not be avoided of which is glucocorticoid and beta blockers. Right, you are into examples of sedative. So this includes benzodiazepines, which include diazepam and alprazolam, and non-diazepam includes epiclone and zolpidem. Uses are insomnia and anxiolytic. Okay. Next is mention when anyone indication dose and route of admission of metronidazole. Okay, so they are using orodental infection, and tablet metronidazole is given 200 to 400 gram and GTDS for 5 days. Okay, due to adverse effect of phenytoin. Okay, phenytoin is given in gum hyperplasia, erotism, and fetal hydration syndrome. Okay, next is newer metrolytes infection. This includes acetinomycin and clarinomycin. Okay, indication includes canoid and ppng or arthritis and donovanosis. Okay, canoid, ppng arthritis and donovanosis. Okay, now next is mention two example of third generation cephalosporins. This includes example cefoxamine and ceftriaxone, and in fact lower tract infection and meningitis. Okay, mention two drugs used in bronchial asthma and their adverse salbutamol and theophylline. Salbutamol is tremor, nervousness, headache, palpitations, nausea, vomiting, gastric irritation. Next is mention one drug and route of admission of atropine. So atropine is given in organophosphate poisoning or drug intravenously 2 milligram, repeated every 5 to 10 minutes until signs of atropization, that is mydriasis and tachycardia appear. Right, two advantages and two advantages. Okay, advantages: convenient, painless and self-administered, or most economical and safe. Drugs can be retrieved via emesis if needed. Disadvantages: slow onset of action, not suitable for emergencies, not suitable for uncooperative, unconscious or vomiting patients. Mention it to example of cardioselective beta blockers. So cardioselective beta blockers include atenolol, metoprolol. Management of hypertension or angina bacterial disease. Advantages and two advantages of low molecular heparin over unfractional heparin. Better bioavailability and longer duration of action, allowing one daily dosing, and predictable response, does not require routine laboratory monitoring. Example: dalteparin and enoxaparin. Mentioned to use nervous of clopidogrel. This includes prevention of myocardial infarction and stroke post rent placement. Clopidogrel prevention of myocardial infection and stroke post stent placement. Adverse effects: bleeding and dyspepsia, that is gastric bleeding and dyspepsia. What are gum paints? Mention into uses. Okay, gum paints, these are medicated liquid preparation applied to gingiva for a local effect. Okay, treatment of gingivitis and periodontitis. Okay, two uses and two advantages of heparin: acute treatment of deep vein thrombosis and pulmonary embolism. Okay, and adverse effect is bleeding, that is hemorrhage, and thrombocytopenia. Next is two drug interaction of warfarin. Warfarin is a displacement interaction and vitamin K. Displacement interaction: aspirin displaces warfarin from albumin binding sites, increasing bleeding risk. And vitamin K, green leafy vegetables rich in vitamin K antagonize the effect of warfarin. Mention any one indication, dose, and route of administration of amphotericin. Indication: acute dental abscess, and dose 200 to 50 gram, and root over. Okay. Next is to uses and to adverse effects of enalapril. It's used in hypertension, congestive heart failure. Adverse effects: dry cough and hyperkalemia. Give two example of aminoglycosides. Aminoglycoside to okay, example is gentamicin, amikacin, and adverse effects are nephrotoxicity and autotoxicity. Next is name two drugs used in penicillin medication and the reasons for their use. Atropine is to reduce salivary and bronchial secretion. Diazepam used to reduce anxiety and provide sedation. Okay, what is the first pass metabolism? So first pass metabolism is the metabolism of a drug during its first passage through the liver or intestinal wall before reaching systematic circulation. Example are nitroglycerin and propranolol. Thank you.